Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Postpartum Care Introduction. One of the happiest times in a woman's life is when she delivers a healthy baby. While the baby may be your first concern, it is also important to think of your own care after delivery. The time following the birth of the baby is called postpartum. During this time, the mother's body slowly returns to normal. However, it is possible for complications to develop after delivery. That is why it is important to know what symptoms are normal and which ones are causes for concern. This program will help you better understand postpartum care. It explains what you can do to help your body heal well and discusses what to expect and when you should call your healthcare provider. Diet and activity. After giving birth, it is important to follow your healthcare provider's directions about diet and activity level. Diet also affects your baby if you are breastfeeding. Do not change your diet without first talking to your healthcare provider. You should continue with the healthy diet you were following while you were pregnant. A well-balanced diet will also help you lose weight and return to your pre-pregnancy weight quicker. Drink plenty of fluids to prevent constipation. If you are breastfeeding, try to drink something each time you feed your baby. Ask your healthcare provider about continuing to take prenatal vitamins. Some healthcare providers suggest waiting 1 week before taking them again to prevent constipation. Slowly increase activities until you are back to your normal routine. For the first 2 to 6 weeks after delivery, you should not lift, push, or pull anything heavy. Remember to take it easy if you had a C-section. You shouldn't lift anything that is heavier than your baby if you had a C-section. Ask for help from friends and family for everyday tasks. However, you should avoid sitting in one position or standing for too long. If you had a C-section, you also should support your abdomen near the incision site while moving, sneezing, coughing, laughing. Do not drive until your healthcare provider says that it is okay. This is usually 2 weeks after delivery. Take breaks from physical activity and rest often. You may be surprised how tired you feel. This is normal. Try to rest when your baby is sleeping. Exercise can help you return to your pre-pregnancy weight. Start slowly and gradually increase the level of intensity. Do not push yourself to begin exercising before you feel up to it. Overdoing your activity can slow healing. Before resuming sexual intercourse, your body needs time to heal. Healthcare providers often recommend waiting 4 to 6 weeks before having sex. This allows time for the cervix to close, bleeding to stop, and tears or incisions to heal. Once healed, there is no right amount of time to wait before resuming sex. After giving birth, some women feel ready to have sex sooner than others. Postpartum blues and changes in your body image could affect the length of time it takes for you to feel ready for sex again. Vaginal changes and the uterus. As the body recovers after both vaginal and C-section deliveries, the vagina and uterus go through changes. Vaginal discharge happens after delivery and lasts up to 6 weeks. Discharge is bright red and heavy for the first 2 to 5 days following delivery. It then becomes pink or brown and then turns yellow or clear. Do not use tampons during this time. Tampons increase your risk of infection. Bright red spotting may happen from time to time and is normal. An increase in bleeding may mean you need to rest more. Passing blood clots is normal as long as they are not too frequent or large. If you soak through a pad in less than an hour or the blood clots are bigger than golf balls, you should contact your healthcare provider. If you had an episiotomy, it may cause pain for a few weeks after delivery. An episiotomy is a cut that your healthcare provider may decide to make between the vagina and the anus during vaginal delivery to make vaginal delivery easier. If you did not have an episiotomy and you experienced a vaginal tear during delivery, you may feel pain for a few weeks after delivery. An episiotomy or vaginal tear will be stitched after delivery. The stitches will dissolve after a couple of weeks. You should keep this area clean by using a squirt bottle of water after going to the bathroom. Ice packs can also help with pain. An incision from a C-section may be stitched with dissolving stitches or staples that need to be taken out. Your healthcare provider will tell you how to care for your incision as it heals. You may feel contraction pains for a few days after giving birth. These pains are known as after pains. They prevent a large amount of bleeding and help the uterus return to its normal size. Breastfeeding also helps the uterus return to its normal size. Breastfeeding triggers the contractions that help shrink the uterus. If you are not breastfeeding, you should tell your healthcare provider if your period has not returned by the 11th week after delivery. If you are breastfeeding, your period may not return for many months. After you stop breastfeeding, your period should come back within a few weeks. Tell your healthcare provider if your period does not come back within 6 weeks after you stop breastfeeding. You may ovulate before you get your period. Use reliable birth control if you do not want to become pregnant, even if you have not yet had your period. Your period may be heavier than normal at first. However, it should return to what is normal for you gradually.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Urination and bowel movement. Pregnancy and delivery also affect the bladder and bowels. Vaginal delivery stretches the tissues at the base of the bladder. This can cause urine to leak when you cough, sneeze, or laugh. Usually this gets better within 3 months as your body heals. Pelvic muscle exercises or Kegel exercises work the muscles that you use to stop urinating. Making these muscles stronger helps you hold urine in your bladder longer. These exercises are easy to do. They can lessen or get rid of bladder leakage. Kegel exercises work the pelvic floor muscles. We use these muscles to stop the flow of urine and to keep from passing gas. Squeeze and hold these muscles for 5 seconds, and then relax them. Do this 4 to 5 times in a row throughout the day. Hemorrhoids and constipation are common problems after vaginal and C-section deliveries. Hemorrhoids are enlarged or swollen blood vessels located near the anus or rectum. You can relieve pain or discomfort caused by hemorrhoids by soaking in a warm tub and by medication. Constipation contributes to hemorrhoids. Drink plenty of fluids and eat foods with a lot of fiber like fruits, vegetables, and whole grain to prevent constipation. Staying active also prevents constipation. If constipation is still an issue, you may take over-the-counter stool softener or laxatives. Talk with your healthcare provider before starting to take any new medication. Some women have an issue with controlling bowel movements. Kegel exercises can also help with this problem. If this continues, check with your healthcare provider. Hygiene is very important. To prevent infections, always wipe from the vagina towards the anus after going to the bathroom. Do not wipe the vagina again with the same wipe after wiping the anal area. You should use a squirt bottle of water to clean this area after going to the bathroom. Breast care. Breasts may be sore after delivery because they fill with milk within 3 to 5 days of delivery. If you decide not to breastfeed your baby, there are some techniques you can follow to stop the production of milk. You should wear a firm, supportive bra 24 hours a day to compress the breasts. To stop the production of milk if you are not breastfeeding, it is important to avoid expressing or releasing the milk. Breasts that are full of milk are also known as engorged. Expressing the milk may relieve the discomfort, but it leads to more milk production. To avoid the pain of engorgement without expressing your breast milk, you can use ice packs or take warm showers to decrease the feeling of pressure in your breasts. If you choose to breastfeed, you should start as soon as possible. This will help stimulate milk production. Nursing often prevents your breast from becoming too full of milk. Engorged breasts may make it difficult to nurse. If your breasts become engorged, place warm towels or a heating pad on your breast or under your arms to help the milk flow easier. Your breasts may also leak milk after delivery. There is nothing you can do to stop the milk from leaking. Nursing pads can prevent the milk from getting to your shirt. Do not use nursing pads that have plastic in them. Change nursing pads whenever they get wet and after breastfeeding. Red, tender areas or streaks on the breast can be a sign of infection. If this happens, you should contact your healthcare provider. Do not stop nursing. Using the infected breast for nursing can help clear the infected milk duct and will not harm your baby. Do not take any medications, including those available over the counter, without first checking with your healthcare provider. Some medications may pass through your milk to your baby. Hair, skin, and mood changes. Your hair, skin, and mood are also affected by pregnancy and delivery. Changes in hormone levels have a lot to do with this. Hormone levels during pregnancy cause your body to stop losing hair. However, after delivery, your hormone levels return to normal and you may lose the extra hair all at once. It can take up to 6 months for your hair to return to normal. You should avoid damaging your hair in any way during this time. Dryers, curlers, or dyes should be avoided. Stretch marks are also a common result of pregnancy. However, stretch marks won't disappear. They will fade over time from red or purple to silver or white. Sudden changes in hormones after a vaginal or C-section delivery may cause the baby blues for a few days to a couple of weeks. Baby blues are a type of depression that is common after giving birth and usually goes away after a couple weeks. About 70% of women experience baby blues after delivery. If you have the baby blues and it gets worse or doesn't go away, you may have postpartum depression and should contact your healthcare provider. Postpartum depression is a real condition that can be treated. Postpartum Checkup. Normally, your healthcare provider will want to see you 6 weeks after delivery for a checkup known as a postpartum checkup. If you had an episiotomy, vaginal tear, or other complication, your healthcare provider may want to see you sooner. During your postpartum checkup, your healthcare provider will make sure you are healing well from delivery. This includes checking your vagina, cervix, and uterus. Your healthcare provider may perform a breast exam. Your weight and blood pressure will also be taken. This appointment is a good time to ask about birth control, breastfeeding, or any other concerns you may have. This includes your physical and emotional health. This appointment is not just important to see how you are healing. It also allows you to open up about how you are adjusting to your new life as a mother. Warning signs. With so many changes happening to your body, it is important to know when you need to contact your healthcare provider. Call your healthcare provider if you have any of these signs: temperature higher than 100.4 degrees Fahrenheit, warm, tender red areas or streaks on one breast, cracked bleeding nipples, heavy vaginal bleeding or passing large blood clots, foul-smelling vaginal discharge, pain, swelling, or tenderness in your leg, severe abdominal pain, some cramping is normal, frequent need to urinate, constipation for more than 3 days, redness, swelling, or discharge from incision areas, severe depression or depression that does not go away. You should also check with your healthcare provider if you have any symptoms that do not seem normal to you. It is better to be safe and check than to possibly miss something.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The time following the birth of the baby is called postpartum. During this time, the mother's body slowly returns to normal. While the baby may be your first concern, it is also important to think of your own care after delivery. With so many changes happening to your body, it is important to know what is normal and what are the signs of illness or complication. To be safe, contact your healthcare provider if you have any questions concerning your health or the health of your baby. One of the happiest times in a woman's life is when she delivers a healthy baby. Taking care of yourself is the first step in taking care of your baby.
Thank you for using Explain.